Tony Klein. Tony has a Master's of Public Administration degree with a concentration in healthcare management and holds numerous credentials in substance abuse counseling and training. With over 30 years of administrative, clinical, and training experience, he is known for his work as an advocate for addressing tobacco dependence and addiction services and the development of a tobacco intervention model that utilizes evidence-based practice guidelines anchored in 12-step teachings and therapeutic community principles. Mr. Klein served as a member of New York State Partnership for the Treatment and Prevention of Tobacco Dependence, the work group that consulted New York State Office of Alcoholism and Substance Abuse Services on drafting Regulation 856 requiring 1,500 New York State certified substance abuse providers to develop tobacco-free services. Mr. Klein has coordinated the establishment of a continuum of tobacco interventions linking inpatient and outpatient treatment and has served as principal investigator for a 3-year study to evaluate a systems approach for tobacco-free residential services. He provides consultation, training, and technical assistance to community providers, municipalities, and state agencies. In addition, Mr. Klein serves as manager of outpatient services, Rochester Regional Health, Unity Chemical Dependency in Brighton, New York. The American Lung Association has brought Mr. Klein to statewide conferences, and we have appreciated his insight around the relationship between tobacco and other addictions. We are happy you can join us today. I now like to hand it over to Tony Klein.
Thank you, Janelle, and good morning, everyone. Let's begin by looking at our overview of the series. Today is March 28th, and as Janelle indicated, we're going to be talking about tobacco awareness. Tobacco awareness is the practical application of facilitating discussion on this topic within existing programming to enhance client motivation and promote utilization of tobacco-free services. So today's discussion will include exploring client engagement strategy, which is the narrative, how to generate meaningful discussion to elevate interest in advanced stage readiness. And we want to do this within a framework of a recovery-oriented message. Practical counseling methods and clinical objectives to highlight the importance to address tobacco while in drug treatment. Now, we have some stated learning objectives. There are 3. The first is to learn to adapt evidence-based tobacco counseling protocols to a recovery-oriented culture. Identify 2 counseling methods to ensure that the intervention is appropriate to the client's stage readiness. And describe 5 tobacco awareness topics designed to advance client stage readiness. So to start, we need to acknowledge that currently tobacco use is the social norm in treatment programs, and there's lots of reasons for that. As we all know, there's a very high prevalence of tobacco use within this population. Overall, a more severe dependency due to comorbidity factors. There are long-standing traditional beliefs that date back to the early 20th century that we've contributed to how treatment providers really have failed to address tobacco. First things first, no major changes in your first year of recovery were things that we were taught, a bigger fish to fry, so to speak. So the image of sobriety included a cup of coffee, a cigarette, a daily AA meeting. We need to actively challenge those old beliefs by facilitating discussion on this topic through tobacco awareness, share an understanding from what the current research teaches us, and then reinforce the new message through a systems approach of routine tobacco awareness sessions. By reinforcing this, we will change the culture. It's going to change the attitude. It's going to impact the interest level of those folks that types of things, So a recovery-oriented message. Currently there's a new way that we're talking about drug recovery. And some people are speaking of recovery movements these days. There's a lot of really interesting things happening through social media, about not being anonymous, being an advocate. Be proud that you're embracing recovery. Share your story and the spirit of hope for a message of lifestyle change. There's an interesting website you may want to explore. It's called I Am Not Anonymous. in which there's a lot of testimonial and this advocacy kind of a message that is being put out there. But as we let go of patterns that reflect active addiction, it's an opportunity to reach our full potential, emotionally, physically, and spiritually. And this is the type of message that we want to embrace as we're engaging into these tobacco awareness discussions. We really don't quit things in life, we replace them. So recovery is addition, it's not subtraction. It's an exciting learning process. As one learns healthy coping skills, we can let go of the unhealthy ways of coping. It's what we're working toward, not what we're leaving behind. This is the framework where we need to facilitate tobacco awareness sessions. So we will adapt the message to our culture. Express the meaning and the spirit of recovery in a discussion on tobacco. We can maintain fidelity to evidence-based practice guidelines, yet modify our delivery to have a greater impact. So we want to accommodate the cultural beliefs, the values, the attitudes, the spirit of the recovery and how we discuss these things. While being respectful to the core cultural values of the recovering community. So we identify the discrepancies between the actual and the ideal behaviors. Is tobacco use an asset or is it a liability? These are the types of things that we want to be questioning as we generate discussion through tobacco awareness sessions. This is a model that Belinda Borelli of Boston University developed for cultural adaptation. And as you can see, it's phase one is really basically collecting the data to fully appreciate and understand and respect the culture. So you're looking at all these surface and deep structure aspects of the culture. And then we go to phase two, which is to make the modification in the treatment content, the language that we use, the intensity of how often we deliver the intervention. There's a host of things that I'm going to speak to here and how we can make more modifications in order to have a greater impact in what we're doing. And then Dr. Bellini will look at phase three, which is the test pilot, collect the data and look at the outcomes of how it worked. One of the most vital things we can do as we change our approach is to make it more user-friendly and impactful through reframing language. Some of you that were participating in webinar one may recall the importance that we placed on reframing language. So smoking the term smoking has a lot of connotations to being rebellious and being sexy and being cool, and when someone speaks about their smoking, I like to reflect back to them and use the more drug-related terms, preferred terminology. You're hitting on the cigarette. You're using your Marlboro. You're waking up in the morning. You need that nicotine fix to feel normal. You don't quite have the wheels turning. So we want to, again, reframe language, which I think is very important to how we relate to the culture and how then we can advance some of the culture change. Instead of quit date, we talk about a recovery start date. We want to be growth promoting. We don't have heroin cessation programs in the United States, and so we don't want to talk about tobacco cessation. We want to speak to tobacco treatment, recovery, and that type of an approach. So let's look a little further at theory, strategy, and practical application. Self-determination theory helps us to explain intrinsic motivation. DC and Ryan take the position that there are three psychological needs that need to be satisfied to become invested in something. The freedom to choose, be self-directed. So we want to have choice. Nobody likes to be told what to do. This inner sense of being competent. So we want to feel like we have good self-efficacy. We're skilled at what we're pursuing. And then that social aspect of it, the relatedness, the connectiveness to other are elements that we want to look at. I consider this as we're developing the therapeutic alliance, how we're framing the presentation when we're talking about tobacco within these discussions. I'm going to elaborate more on that in a minute, but I actually think of this and try to design my presentations to support this type of a climate. Everybody on this call, I assume, is very familiar with the trans-theoretical model and stages of change. So this is, again, making sure that the intervention is designed to meet people in whatever stage of change they are at. And we all know the definition of this. The pre-contemplative state, of course, is where the desire to change is really not on the radar screen yet. Contemplation is where we see ambivalence towards the change. Preparation is where we start to neutralize that ambivalence and start planning for moving into action. Action is a very difficult place to be because when you first do anything, it is not familiar, it feels awkward. As we reinforce the new behavior, after a while it will become the norm and we move into maintenance. So there's two indicators when we're talking about stage readiness that I also want to speak to. How important is this to you, or how confident are you in getting the job done? Our tobacco interventions need to directly address these two indicators. So discussing the importance will advance change talk by generating discussion around this. That would be our clinical objective. And then, of course, teaching coping skills to elevate confidence and instills a sense of hope for the behavioral change. So the two interventions, and again, these are two separate. This is the engagement strategy. How are we going to talk about this to accomplish that sense of dialogue where people develop an interest, highlight the importance, and advance their stage readiness? It's all cognitive. It's all beliefs. It's all talking about this where we're just exploring how is tobacco part of your life and how do you feel about it type of a thing. Tobacco recovery then is the actual behavioral change where we're actually establishing and then maintaining tobacco abstinence. So again, very two separate interventions. John Norcross, who is a researcher and psychotherapist, I believe at University of Pennsylvania, I attended one of his workshops, and this is what I walked away with. Norcross did this talk on psychotherapy relationships that work, and he made a very interesting point, saying that when you're developing awareness discussions to help advance stage readiness, the assumption when walking into the room should be that 40% of your group will probably be in some pre-contemplative state with regard to the behavioral change. 40% will be in contemplation, basically. And then 20% will be more in preparation or the action stage. Now, Norcross made the point it's important to consider this because we have to design our message and our communication to make sure that we capture 100% of the audience. We can't segregate anyone or have people shut down because we're talking about things that they're not ready to hear. So the way we design our tobacco awareness sessions, again, and the use of motivational interviewing, you can see, is the most effective means of counseling method for those in pre-contemplation and contemplation. So tobacco awareness is basically a group motivational interviewing intervention. When we are helping to deal with tobacco recovery, the behavioral change, that's more of a cognitive behavioral therapy, and that would address preparation and action. Another thing that Norcross shared, which I found very interesting that day, is the presentation of the therapist. What role should we take as we're addressing different stage readiness? When someone is in a pre-contemplative state, Norcross said, be the nurturing parent. This is someone who listens more than we talk. You give the person a hug. You're very encouraging. I'm sure that you're going to be successful in this. You're just that type of. It's like the grandma that's going to give her grandchild a hug, and just you want to feel good about being around that person. When someone is in contemplation, you want to be very inquisitive, where again you're asking a lot of open-ended questions and using a lot of reflection in the process. So the therapeutic alliance with regard to the facilitation of tobacco awareness, this is the type of presentation that you want to take. You want to try to advance this nurturing parent and this very inquisitive type of Socratic teacher is how we're presenting ourselves within those sessions. The goal, again, would be to promote insight into tobacco use behavior. We're going to be exploring how does tobacco play a role in your life. We're going to identify the correlation to alcohol and other drugs through, again, always a recovery-oriented message. Is tobacco helpful or is it a liability to your recovery process is the open question. We want to promote ambivalence and we want to elicit change talk. We do this again through motivational interviewing. Narratives are very helpful in this area. You want a lot of storytelling. You want to see peer-to-peer dialogue happening. And then we're just, fostering teachable moments. So when somebody indicates or makes a point, I boost my high with a cigarette every time I'm done with the blunt. Would you like to learn more about why that is so? There's some interesting research that I can share how the neurochemistry is affected. So you lead into then teachable moments, but it has to be client-centered. It has to be coming from your audience, not walking in with the agenda and having the discussion that the way you plan it. So tobacco awareness facilitation, the more change talk that clients demonstrate, the more likely it'll be that they'll move towards making a change. This is what tobacco aware, having a component of care in our programming where we're talking about tobacco in this client-centric way to explore the meaning of tobacco use in their lifestyle. The more you do this, the more you're going to hear change talk. And that's our key objective here. It moves stage readiness, and by having those discussions, it will denormalize tobacco use within the culture. I'm sure many of us are trained in motivational interviewing. So again, the method of motivational interviewing, it's a client-centered counseling style for eliciting behavior change, and the principles, the basic skills, the open-ended questions, affirming the strengths, reflective listening, summarization is very important. How we build motivation is through asking permission. Again, the reflective listening, raising concerns, summarization is all key to how we facilitate tobacco awareness. So what does a great facilitator do? Well, it's very important not to demonize tobacco. This is not your opinion that you're expressing. We don't want to walk in with the pathology slides of emphysema or the, how many people die of cigarette statistics. This is just, I'm really curious to learn how cigarettes are part of your lifestyle right now. So it's just a very neutral position that we need to take. We want to demonstrate a real, genuine honesty of the group. Be aware of the mood and behavior of the individuals. Now, I say that because just talking about cigarettes can be a cue or a trigger for some people for cigarette craving. So you want to watch out for that and then talk about it, indeed it occurs, to help address it. Demonstrate active and reflective listening. Ask questions that encourages client self-disclosure. Promote peer-to-peer dialogue. Inject a sense of humor in this. You're going to hear a lot of goofy stories where people will talk about the great lengths that they go to get that cigarette in a restricted area, or the way that they feel when they're without it before the snowstorm and they can't get out to buy another pack, or some of those kinds of stories. So just to highlight that and keep the the discussion lively and upbeat is what I'm saying here. There may be some people that will be threatened by this as well, so expect some opposing comments or conflict within the group. And again, summarize the discussion. Typically I will facilitate a tobacco awareness session that'll be for somewhere around 45 to 60 minutes, and probably every 15, 20 minutes I'm summarizing what's happening, so the key points that were made. Now, these are the facilitator topics. So looking at the traditional use of tobacco use in the recovering community, how is that changed by what we know with regard to the recovery movement, our new thinking on this, what the research has taught us about cigarettes that we didn't know years ago, sharing how cigarettes have been re-engineered to make them more addicting. Again, the tobacco industry studied the drug culture, and they wanted to know how to boost the addicting properties of cigarettes, how to make them more fast-acting and more reinforcing. Highlight and thoroughly explore the role that tobacco plays within the alcohol and drug use, to hear from folks with regard to their personal experiences with that, and to thoroughly explore that with them. There's there's different terms for it in different regions of the country, but one of the things that I've learned by facilitating tobacco awareness sessions is the use of what's called a love boat. Now, a love boat is a cigarette that is soaked in formaldehyde and typically laced with heroin. It's very common, I'm guessing, in some parts of in Northeast, where you're going to your dealer and you buy your bag of dope, and you also get a few love boats, and it's part of that ritual to have folks talk about that, and then to expand upon it is interesting. Number one, what's the meaning of the use of the love boat afterwards? How does it influence your mood-altered experience? But also just the why would they soak it in formaldehyde? Here's an open door to talk about how formaldehyde is part of the tobacco mix, and just how you change the chemical composition of this re-engineered product called a cigarette to make it more addicting. But you're now having a discussion that folks will have insight on from their own understanding of addiction and the lifestyle, one actively addicted, and it'll again lead to some very interesting sharing and that type of a thing. Acknowledge how tobacco use may increase the potential for alcohol and drug relapse. Again, there is a meta-analysis that shows that by stopping tobacco in early recovery, there's a 25% greater chance of longer-term abstinence as we let go of the patterns of behavior around the tobacco use. It promotes a better quality behavioral change around the recovery process. So there's a lot of ways we can talk about that with our folks in the group. Conduct a group decisional balancing exercise that's looking at the costs and the benefits of changing the behavior. And then elicit client experiences on the emotional attachment. So the cigarette is more than just a nicotine hit, or something to do with my hands, or it's actually a companion, it's a friend, it's an old reliable emotional support. It's been with me in the good times and the rough times, and to let go of that, there's a grieving process. There's a fear of that emotional security, and so we talk about that detachment and the letting go process as well. Okay. So, clinical objectives: create a safe therapeutic environment to set the tone and direction of the discussion. Again, approach this topic from the client's perspective, their experiences and their knowledge of chemical dependency and drug recovery. We want to create those teachable moments so then we can add to that by sharing the current research and what we know about this. As we walk through that session, again, develop a consensus. So this is why we're summarizing. So, What I'm hearing so far today is that many of us believe that tobacco use is fundamental to how you get high in other drugs. Am I hearing this okay? So you want to validate and summarize and make sure that there's an ongoing key points that are building and evolving as we kind of walk through the session together. So this is a client-centered approach. Again, support autonomous motivation. We want to set the stage by providing a brief overview of the topic of the discussion. I'm going to explain more to that in a minute. Establish or emphasize to the group that their verbal contribution is valuable. This is all about the group. I'm really interested to hear your experiences with this. And then again, asking permission, which is the motivational interviewing teaches us, will help engage people in a different way. So here's a sample dialogue. Good morning, everyone. I'd like to explore some aspects of addiction and recovery that may be new to some of us. What you do with this information is totally up to you. All right, I'm giving them choice now. Nonetheless, it'll be interesting to see if any of us can relate to the topic from personal experiences. So with your help, I'd like to explore how tobacco use may be a part of the use ritual of other substances. Does anybody in this room hit on a cigarette or a cigar while drinking or getting high? Is tobacco a part of your drug use ritual? I believe that you'll find this discussion helpful, and I'd like to share some current research on this topic. Is it okay to talk about this? They always will say it's okay to talk about this. So then you start diving into it. So let's start by seeing if there's a connection for some of us to alcohol. When you're drinking, is a cigarette a part of the picture? Would anybody like to share your experiences? Now you're inviting the peer-to-peer storytelling, the narratives, the discussion. Again, as your clients will share their experiences, we want to reflect. So you can amplify or different means of reflection, but you always want to make sure that you're listening, you're hearing what they're saying through summarization and reflection. The objective is to sustain and enrich that dialogue, but again, keeping the center attention on the clients. And you don't want this to be a Q&A type of a session. So you avoid that, and it's just all about testimonial. I want to hear how cigarettes play a role in your life. Now, it doesn't have to be categorical for all of these substances. Often you'll be talking about all of them at once, but you want to make sure, is there a difference with regard to how the cigarette is woven into the ritual of drinking alcohol versus smoking marijuana or using other substances? And people will find that very interesting, and you're going to hear a wide range of examples that will add to the discussion in a meaningful way. So was it sometimes there or always part of your drug use? If it was always there, you mean it was always there? You never got high without having a cigarette as part of it. It sounds to me like the cigarette is really a major player in your addiction. Is that true? So you're amplifying this, you're highlighting it, you're putting voice to something that we don't want to be silent anymore. Would you hit on the cigarette before, during, or after you're using? In this case, I'm talking about hitting on a blunt. How are we exploring how does it fit into that ritual? Was the experience differently? When you're getting high with the cigarette, is the high different? Is the mood altered effect of your high? Does it change it? What's the rhyme or reason to doing it? Why was it so important to be in that? So you're exploring all of these types of areas with regard to, say more. What do you mean? What would you do if you had a bag of dope but didn't have any cigarettes? So as I say here, typically you'll experience a session with most clients acknowledging that tobacco use is central to their drug use ritual and indicative of addict thinking, feeling, and behavior. And again, as those are, those conclusions are shared, this is where, again, we want to amplify them and summarize them and keep the dialogue flowing, maintain that emotional energy in the room. Typically, these sessions are liked. People enjoy talking about themselves. And so if you're just probing in and asking them, what does this mean to you, there's usually very good participation. So a point here that we want to make as well is with reflective listening, there's, of course, simple, amplified, double-sided reflection. But we also can change the course of the dialogue by reflecting content, feeling, or meaning. So here's an example of that. Let's say that someone states, I always need to smoke a cigarette when I'm getting high. I go through a whole pack when drinking or drugging, and I totally panic when I'm down to my last cigarette or run out. You'll hear different variations of that message. Now, when I hear that, I can reflect content if I want to go in the direction of identifying, again, how cigarettes are woven into drug ritual. So I could say there's a strong association between your drug of choice and tobacco use. I also could go in a different direction, and that would be you get anxious when you run out of cigarettes. So now you're getting into the feeling stage. We're going to talk about how does it feel when you're in that kind of place. And is a feeling similar to when you don't have your drug of choice? And it's so I mean, there's again different places where that'll go in terms of different pathway of the discussion in the room. Meaning reflection, now the example I gave here is in reference to 12-step terminology, and it's amplified. So if someone says, I totally panic when I'm down to my last cigarette and I run out, if I feel it's appropriate, I may say, so powerless over nicotine, and that'll get a reaction from the audience, where then we can further explore this. So the point is, again, the facilitator, the role that we take is really just to keep the dialogue going. You're going to have plenty of folks that are going to want to share their experiences with this. But how do we then flow the discussion where it can be productive in terms of seeing how people relate to one another? And again, the message is to acknowledge that this is part of the process of addiction, and it can hinder recovery if we maintain those behavioral patterns. So the point that I want to make here with regard is that this is very easy to facilitate. I mean, what we're really doing is just generating discussion and reflecting responses. The more that we facilitate these types of sessions, the more narratives that you're going to hear. And then you can share that. You can share those stories in subsequent sessions. So, for example, a term that was that came out of one of these sessions years ago was someone said, well, gee, I think the cigarette is the pilot light to my addiction. And that was something that resonated with the group, where, of course, the effect of smoking tobacco is not going to have the same consequences as when you're using your dope or using other substances. But if the cigarette is always associated to the ritual of those other substances, we're keeping alive the pattern of behavior by continuing with the tobacco. And so you're going to hear those types of narratives, which will be interesting. I've been doing this for like 30 years, and probably about 20 years ago, I started hearing some things which I found hard to believe at first, but then through the repetition of it, I realized that it was the case. And I say here, the more depth to client disclosure will be presented if you do this in a routine basis and you establish a safe place where people then can talk about these things. But I remember one young man who shared being incarcerated, where he wasn't craving his dope, he was craving a cigarette after being in a communal part of a county facility for a number of hours. And he talks about how he actually reached out to an inmate and performed a sexual act on him in order to get a rollie. The guy had some tobacco rolled up in cellophane in his rectum, and he pulled it out and made up a little rollie out of toilet paper, and then they had this little exchange where the guy got the tobacco. And talking about the great lengths that he would go to in order to manage that craving and deal with the withdrawal. Stories like that, believe it or not, are not rare. I mean, you're going to hear stuff like that when you facilitate these types of sessions, and if you do it in a regular basis, where then we can, bringing that into light, having shed some light on that is where this will really embed this in a way that'll have real meaning to folks that are seeking recovery and realizing that these are behaviors that are not consistent to where I want to be in terms of what I'm working toward in my recovery process. So the more you do this, the better you'll be able to reframe the language for greatest impact and really be able to facilitate that peer-to-peer dialogue in a significant way, learn more about the topic from a street perspective. Don't be afraid to say, I don't know. A lot of folks, when they first start doing this, will say, well, I don't know all the research. I don't know about the neurochemistry and the, some of the behaviors that are related to this. And you'll learn it by doing it. I mean, that's all. Jump in. The water is fine. The more you do this, the more you're going to hear, and you can do a little research if you want, and search of what's in the literature, and you'll see that these sessions will flow very well. The key, though, again, is that this will change the culture. It's meeting people where they're at. It's going to advance stage readiness. After these discussions, this is where people will say, can you help me? I think I want to make this part of my recovery process. And that's where then we can move into the intervention of tobacco recovery. So we have some time left, like 20, 25 minutes. And so I'm open now for questions. Janelle, do you want to?
Thank you, Tony. Thank you for all of that. If anybody has questions, please type them into the chat box in the lower left-hand corner, and I'll be happy to pass those on. A couple questions, Tony. And you did start to address one. On slide 24, you were talking about suggested topics during a session. And
Okay.
And the question came up, well, what if I'm not an expert? What if I don't know a lot about how cigarettes are engineered? I mean, how can I become an expert to talk about those things?
Well, first of all, you don't need to be an expert to begin. That if you know how to facilitate a group, if you know how to reflect responses from people, if you know how to probe in with follow-up questions, I'm looking for slide 24 here as we speak. I think I passed it already and apologize for that. So, again, where if we, would you find that? That'd be great. You go in there and you talk about it, and then you'll hear questions or people will bring up points where, you might have to do a little research. I'm sure the American Lung Association has a lot of statistics and facts that can help you with this. There are resources out there. I mean, you just do a search and you'll find information with regard to that. We can talk about this more. If you ever participated in webinar 1, I did speak to some of how the tobacco industry re-engineered this drug delivery device called a cigarette and how it influences neurochemistry, primes the brain for addiction. There's some interesting, information that's there. So what I'm just saying here is that you'll kind of learn it as you go along. Don't let that prevent you from diving in here. It's just start doing it, be genuine, show an interest in our clients. We now know that addressing tobacco in treatment is advisable in order to have a better quality of recovery. And so I'm really interested in exploring this with you guys to see what your thoughts are on this. How is cigarettes part of your lifestyle, and what do you think? It's just go into it with that kind of open-ended attitude. And be very inquisitive. You're going to learn stuff as you go along. When those moments that can lead to a teachable event where it would be appropriate to share some kind of data or information, you will you'll learn. You'll learn, or you can say, all right, let me get back to you on this. And I mean, again, you have to just do this over time, and it'll evolve. But even if you don't know all of the stuff that you're concerned about right now, you still will have a very effective session by just talking about this. Again, we just want to make sure that we're denormalizing this. It's not in the closet anymore. We want to talk. I talk about alcohol every day in my clinic. I talk about heroin every day in my clinics. I talk about, we need to talk about tobacco every day too. So it becomes a expectation that this is part of the substance use disorder issue that we're dealing with, and then you're gonna see a change to attitudes and stage readiness, and the understanding of this in a more expert kind of a way will come. It'll happen for you.
Thank you. We have another comment that tobacco use may be used as both a stimulant and a depressant. So educating participants on that would be helpful. For example, I may smoke to get myself going in the morning, yet when I'm stressed, I may smoke to try to relieve anxiety.
Oh, absolutely, and that's what you're saying is great, because that's the kind of comments you're going to hear from your group when you're doing this tobacco awareness stuff. So then you explore, why is that so, do you think? And part of that may be the dosing of how you're exposing yourself to the cigarette smoke, the hand-to-mouth movement, the intensity of how you draw on the cigarette. If we're using it in a more rapid fashion, it'll tend to provide more of a stimulant type of effect. When you watch the same person who's smoking in the morning here, as you say, to get going, when you're smoking, let's say, in the evening to relax, you'll see a different hand-to-mouth movement. So there's a self-medicating effect that is going on with tobacco smoke. And so to explore that, and again, just put that out there, and you're going to hear a lot of the group members are going to want to offer their personal examples of how that plays out in managing anxiety, dealing with stress, stimulating or dealing with how you're using tobacco to alter the mood. So tobacco use is not intoxicating, but it very much regulates mood. And then when we pair it up with other substances, it has a synergistic effect in terms of not only how the tobacco influences mood, but then how the other substance influences mood. So the discussion, it can go very interestingly into a lot of areas with regard to this whole concept of self-medicating with things, and how to what's the meaning of it? How does that reinforce? How does it become automatic pilot? And when people say, I always have a cigarette whenever I'm getting high, and you explore again where in the drug use ritual that is located, what is the meaning of that? How does it make you feel? Again, is it pepping you up? Is it calming you down? Is it boosting your high? Is it what's the meaning of it? And that's where then again you're going to hear some interesting disclosure, and it'll anchor this topic in a place where people really want to talk about it, and that's our clinical objective.
So you talk about the tobacco awareness conversation being separate from the engagement with the behavior change. So how do you handle it when you're facilitating a tobacco awareness session and a group member indicates readiness to quit?
Great question. It's sort of like putting it off in the parking lot kind of a thing. I will say, well, so it sounds to me like you're interested in really making this part of your recovery, stopping your tobacco use, and the person will say, yeah, I am. How do you do it? How does this patch work? Or, they'll start asking those kinds of questions. And my response typically is, well, I'm really happy to hear that you're motivated to do something about this, and I'll look forward to setting up an individual appointment with you where we can develop a personalized recovery plan for you around tobacco, and we'll go from there. So let's set that up after the session, and then I kind of redirect. I go back to the 80% of my audience that I know is in pre-contemplation or contemplation. So you want to address it, but you want to make it brief, and then use that as an opportunity to follow up with scheduling an appointment to further explore it with the person that is you do not want to start talking about behavioral change though with that group, because again, the 80% of your audience probably isn't going to want to hear it, and they're either going to get aggravated or they're going to shut down, and that's not our clinical objective for this particular intervention. So you acknowledge it and then follow up with the request.
So you mentioned early on to watch the group clues, and that even talking about tobacco will trigger cravings for some people. How do you recognize that in a session, and how would you address the current craving that somebody would be feeling in the session?
Well, sometimes people will actually say it, man, talking about this is making me fiend here, or, you'll hear comments like that. But you look around the room and you're watching body language, you're watching affect, you're watching to see how people are listening or not listening. So you're constantly looking things over, and if someone is getting jumpy in their chair and a little I will ask, for some of us, I don't direct it at an individual, but I'll say for some of us, just talking about this topic sometimes can be a trigger, and it's interesting that our addiction to tobacco can be so powerful that would be the case. But again, that's one of the things we learn about in treatment, how we have different behavioral triggers or cues. And is anybody experiencing any feelings about this right now? Is it making you want to think about, a cigarette or crave a cigarette? And so I'll put it out there. I'll just see how many hands go up or what, and then we can actually do some experiential thing. Would you like to learn how to? Let's do a relaxation breathing technique right now to see how we can manage a craving, and this could be tobacco craving or any craving. But so maybe we'll engage in some kind of an exercise, a mindfulness exercise, some kind of grounding exercise or something that teaches a coping skill of how to deal with that kind of thought, how to redirect the thought, and those types of things. So you can use it as an opportunity but again, this has to be with permission of the group. This has to be a group consensus. I'm not going to go there by my directive. It has to be, would you like to do this, yes or no? And if they say no, then you kind of move on. The other point that this reminds me of is sometimes people will be folks, I guess, in a pre-contemplative stage of change will be aggravated by the topic. It's like they'll be threatened by it. I'm new in recovery. This is a difficult time for me. I don't need to hear this right now. My sponsor told me not to deal with this, and so having the discussion will bring out some feelings that will promote some anger or not being happy about what we're talking about. But they won't verbalize it. They'll just be sitting in their chair fuming and snarling at you. And so if I see any evidence of that, I will voice that opinion. If you remember the suggested facilitator topics, the first one is the traditional use of tobacco use in the recovering community. And I'll talk about, there's reasons for why a sponsor might say to somebody, no major changes in the first year of recovery, and that includes tobacco. And that, that reflects social norms of 1935 at the first AA meeting, where the couple of a physician and a stockbroker got together and had a cup of coffee and a cigarette, because that's what you did in those days. And that image, that tradition, sort of has been carried through in 12-step programming. So we try to explore the cultural reasons for why people would say something like that, and then create a teachable moment. But we've got to get real. We've got to know that the research is telling us something new now, and we need to embrace what we're learning from research, and it's important for me to be here today to share this with you. What you do with this information is your business, but I want to make sure that we offer you the best possible treatment experience and respect the fact that this may be something that may be an issue for you. It may not be, but it's something that I think is important to talk about. So you frame it in that type of a message, and you ask for help too. What is recovery? How many think that why would we want to talk about tobacco today in this fashion? Why do you guys think this? And you'll hear comments that will reinforce the importance to do it, and thank you. I'm grateful that you brought this up, kind of a message, if we use this kind of client-centered approach. So, again, the timing and of what we're sharing and how we're rolling with it, so to speak, that you don't want that person to be sitting in the chair fuming. You want them to be brought into the discussion and hearing not only from what you're saying, but more importantly from what their peers are saying about this topic, and that'll neutralize some of the concerns. But what the facilitator has to say is, what you do with this information is your business. I'm not here to take a position or suggest to you that you should stop your tobacco use. That's your decision to make. If you choose to do that, we're going to have services here within this program to help you with that. But that's not what our discussion here today is about. It's just to kind of explore the meaning of this, because I really need your help in learning about this. So you take that kind of position with it.
Thank you. So can you say a little bit about the context of a group session on tobacco awareness in a treatment facility? Like, would this be a topic that is just on a regular rotation, on a regular group meeting, or that there would be specific sessions scheduled on tobacco awareness that everybody would go to?
Great question. I'm very happy you asked that. I believe in a systems approach. So yes, this should be part of the procedure for tobacco-free services. And depending upon your modality, your level of care, we can do this in different ways. What's the length of stay of your program? Is it a outpatient setting, inpatient, residential? I mean, where you're actually doing this will help dictate the frequency and how it kind of fits into your components of care. In an outpatient setting, again, depending upon your length of stay, but we typically do this in our outpatient clinics every 8 weeks. We have a program where most people are in treatment for 9 to 12 months, and in their initial programming, which we call early recovery skills, that usually lasts for 2 to 3 months, where it's a more intensive contact. People come to our programs for a 2-hour group 3 times a week, and then individual sessions on top of that, and they do that for 2 to 3 months. So within that early recovery skill component of the program, we have tobacco awareness sessions on a rotation automatically built into our programming every 8 weeks. In an inpatient program, again, depending upon the length of stay, but we have done that weekly in our inpatient programs, where it's just, again, part of the schedule where we have discussions. Now, I'm sharing, when I talk about the suggested facilitator topics, and perhaps we can further advance that understanding in our technical assistance call in April. I'm sharing with you real fundamental stuff, but again, there is different way. You want to keep it fresh. You don't want to sound like a broken record here at every session and do the same type of session. So you want to have sort of like a curriculum that you rotate, where the message is still there. We're still reinforcing this and making sure we're talking about it in an impactful way, but we're approaching it from a different angle. For example, the group decisional balancing exercise I made reference to. Many of us who subscribe to motivational interviewing understands the method. we can do a group type of a balancing exercise where I don't even talk about tobacco at first. I'll just a decision exercise of choosing recovery or choosing to continue to use is the way I present it. And I ask people their views. I always start out with what's the thinking? Why would somebody want to continue to use? What would be the costs or the benefits of that? And I'll ask them to, I'm usually at a big marker board or whiteboard or something where then we make a list and I ask everybody to do that. And as people are contributing to that list, I'm reflecting back what they're saying, and I'm again amplifying and using different techniques of summarizing the comments that are being made. And then we look at the costs and benefits of recovery. Why would somebody choose recovery? What's the thinking there? After we thoroughly go through and develop that information that's written on the board, I will talk about alcohol, I'll talk about marijuana, I'll talk about heroin. What the message that I'm trying to say is that what the takeaway from that session will be is that the pros and cons, the costs and benefits are going to be very similar. You're going to see that the same rationale, the same thinking of how I would justify my next cigarette is how I'm justifying my next joint or my next drink or my next use of a drug. And the same reasons why I'm thinking recovery is a good idea in the value of recovery, or there's a parallel here that takes place across the board. So people are realizing that this is just another addiction, and my thinking of how I'm either justifying the continuation of tobacco or I'm starting to think about why this would be important to be included in my recovery process by establishing abstinence around tobacco. That there's a similar type of a thought process that's playing out. What I've learned over the years is the behavioral defenses that one applies to one substance typically will parallel and be applied to other substances, and that includes tobacco. So just kind of shedding light on that and talking about it in a way will be interesting to people. It'll light up some light bulbs there, and can be a just a productive session to have. I hope I answered your question.
Great. I think you answered a few questions that people had. One was asking specifically about working with a pre-contemplation group about substance abuse. So it's engagement for the substance that they came in for, and should the issue of tobacco be presented as well? It sounds like you're saying definitely yes.
Yeah, but it's how you weave it in the discussion. So it's like, why are you here? What does recovery mean to you? What is your thinking with regard to changes that you want to see in your life? I mean, you start out at a very fundamental basis for all of that, and then when it's appropriate, you can, depending upon what you're hearing in the disclosure, how and where you can link tobacco use behavior into that would vary, but there's always going to be an open door. You'll always find an opportunity to make that happen.
All right. Thank you very much, Tony.
I just want to say I love these questions, and I'm really looking forward to the April 11th Technical Assistance Conference call, because I really invite everyone to give this a go, facilitate a session or two, and I'd be really interested to hearing your experiences with that.
So yeah, we'll be back 2 weeks from today for our first technical assistance call. So this is an opportunity for you to engage more directly or one-on-one with Tony as an expert, and with his expertise in this area, that you can bring your questions to us and use him as a consultant to your particular situation that you find yourself in with your practice. And then 3 weeks from today is our next webinar on behavioral interventions on tobacco recovery. And the focus will be helping clients establish and maintain tobacco abstinence. So as we close the webinar, you can watch your email today and tomorrow. You'll be getting 2 follow-up emails. One will contain the recording and the slides, and it will also have a link for you to register for the next webinars and technical assistance calls if you haven't already done that. And then the other email will contain a link for the evaluation survey, which contains the CEU form. So we appreciate feedback from all of you as it helps us plan our upcoming activities. This evaluation survey does need to be completed for us to be able to track and issue the CEUs and certificates of attendance. And these certificates will be issued in June at the conclusion of this entire series. So thank you very much for your attendance. And if you have any questions, please contact the people that you see on the slide on your screen at the state that you're in. Thank you so much.